Chitra madam, you and Sunita madam are co-hosts.
Yeah,
Yes.
yeah. But you give permission for Sukanta sir to share his slides.
Yeah, just once.
Yeah.
Yes. We are live.
Yeah.
Hello, madam. We are live.
Yeah, thank you so much,
Yeah.
Dr. Vishal. Good afternoon to all the esteemed, respected dignitaries in this webinar. Myself, Dr. Chitra Kulkarni, welcome you on behalf of Maharashtra AHA, Raigad IAP, Raigad AHA, as well as our partners, Rotary Club Kharghar Midtown and Innerville Club Khopoli. Our sister branch, Palghar Academy of Pediatrics, is also here with us for today's webinar. At the outset, I want to express my gratitude to all of you and our speaker, Dr. Sukanta Chatterjee sir. We are in a noble cause of increasing the awareness for next generation. Today is World Senior Citizen Day, and for us, it is time to give back to society. So we are here with you. May I invite my co-moderator, Dr. Sunita Ingre, for a formal welcome of all the guests. Over to Dr. Sunita.
Thank you so much, Chitra. A warm welcome to all for this today's webinar, which is a very needed topic of the today's times. So we welcome and acknowledge the presence of our esteemed dignitaries for today's program. Dr. Sukanta Chatterjee, sir, who's the EB member of Central IAP 2025, and also the today's speaker. Dr. Jain Pandrikar, sir, Central AHA, EB. Then Dr. Shailaja Mane, madam, Maharashtra AHA chairperson. Dr. R.G. Patil, past Joint Secretary, Central AHA. And Dr. Jayshree Deshpande, who is the IIP Palghar President, Dr. Vikas More, IIP Raigad President, and of course our Rotary Club Kharghar Midtown President, Dr. Ravi Kiran, and Mrs. Deena Shah, who is the President of Innerville Club Khopoli. I also acknowledge and welcome all the office bearers of Maha AHA, Central AHA, IIP Palghar, IIP Raigad, and Rotary Club Kharghar Midtown and Innerville Club Khopoli. Now, I will invite Dr. Vikas More, IIP Raigad President, to give his welcome address. Over to you, Dr. Vikas. Dr. Vikas?
Yes, madam. Hello? Hello?
Yes, continue.
Yeah,
Am I audible?
you are audible.
Okay. So, thank you so much, madam. On the behalf of Maha AHA, Raigad IP, Raigad AHA, and Palghar Academy of Pediatrics, in partnership with Rotary Club Kharghar Midtown and Innerville Khopoli, I warmly welcome you all to the today's important webinar on understanding sex and sexuality in adolescents. We all know that adolescence is a delicate and transformative stage of life. It is a period when curiosity, confusion, and challenges about identity, relationships, and sexuality naturally arise. As parents, teachers, and healthcare professionals, it is our collective responsibility to guide our dear adolescents with accurate knowledge, with empathy, and with open communication. And this is a webinar where we have an excellent opportunity to learn from the experts like Dr. Sukanta Chatterjee, who will share the valuable insights into adolescent sexual health, the latest backed by latest research and the strategies to support the healthy development. I encourage all participants to listen, reflect, and actively engage because the knowledge we gain today will help us to empower our youth with confidence, safety, and dignity. Let us together break barriers, foster understanding, and create a supportive environment where our adolescents can grow into healthy and responsible adults. Uh, I also welcome respectable Jayan Pandrikar sir, Patil sir from Pandrikar sir, who is my PX president from Amravati, and Patil sir from Nagpur, respected Sukanta Chatterjee sir, for their presence and their guidance. And I'm also thankful to all the NGOs who are assisting, consistently getting associated with IIP Raigad for these various noble initiatives. Thank you so much. Over to you, madam.
Yeah, thank you so much, Dr. Vikas. Now I invite Dr. Jayan Pandrikar, sir, for his blessings. Over to you, sir.
Very good evening. Thank you, Dr. Sunita, madam. Today's guest speaker, Dr. Sukanda Chatterjee, sir. Then the AHA Vice Chairman, Dr. Chitraji, Dr. Sunita ji, Dr. Aji Patil, sir, Dr. Vikas ji. Then all the organizing branches like Maha AHA, then the Palghar AHA, Raigad AHA, Palghar IAP, and all the dignitaries on the dais and all the delegates. I must congratulate all the organizers for organizing such a beautiful webinar on a very important topic of sexuality and adolescence. We all know the adolescence is an age of autonomy, identity, experimentation, and exploration. It's okay with other field where they are exploring, but as far as sexuality is concerned, they have to be very much careful, and that is what we are going to learn and listen from Dr. Sukanta sir. At the same time, I would appeal all the delegates, all the pediatricians who are attending this webinar, they must take up this knowledge to the schools, to the adolescents, so that they should get the actual scientific information regarding sexuality and sex. Once again, I congratulate organizers and thank for giving me this opportunity. Thank you very much.
Thank you so much, sir, for your brief address. Has Dr. Shailaja Mane joined?
She is probably busy. May I invite Secretary Maharashtra AHA, Dr. Sangeeta Lodha, madam? Dr. Sangeeta, can you share your views? I think we should go ahead. Once they join, we will again invite them.
So,
Okay.
over to you,
May I invite past Joint Secretary of Central AHA, Dr. R.G. Patil, sir, to introduce our esteemed speaker.
Am I audible, Chitra?
Yes, yes.
Yes, you are.
Yeah. Thank you, Dr. Chitra. It's a great honor and privilege for me to introduce Dr. Sukanta Chatterjee, sir. Actually, way back in Nagpur, 2008 or 2009, sir was a secretary and used to organize the midterm conference. And it was a very successful and meticulously planned by Dr. Sukanta Chatterjee, sir. And it was his guidance we were successful. In those days, we used to organize this midterm conference before the national conference. It was a grand success, and from that time, the midterm conference was cancelled due to large response. And secondly, used to meet in the conferences. Sukanta Chatterjee sir has a discussion what we can do for the adolescents. So I told him that it is better to have some coordinators from the East states. And on the second day, Dr. Sukanta Chatterjee appointed me as a Maharashtra state coordinator. He was so commitment and he worked for the betterment of the adolescents. With this short introduction, I will introduce. He's a former professor and head of pediatrics, Calcutta Medical College. Sir is a chairperson of Adolescent Health Academy IIP 2023. He is a coordinator joint professional group of AHA, IAP, FOXY, IAPHA, and IAPSM, and adolescent sexual and reproductive health. And he has an adolescent clinic in charge for 14 years at MCH and KFC. And I welcome Dr. Sukanta Chatterjee for his talk on sex and sexuality in adolescent. I welcome you all Dr. Sukanta Chatterjee, sir.
Thank you, Dr. R.G. Patil, for the nice introduction. And I welcome all the IAP, AHA, Raigad, and the AHA Maharashtra, and of course, R.G. Patil is there. So it is extending beyond that. Also, everyone, Dr. Bikash and all others, Jayant, who has given their introductory speech. I thank all of you for inviting me here and greeting me. Now, should I share my screen?
Yes, sir. Sir, please.
Now, is the slides visible?
Yes, sir. Yes, sir.
Okay, let me start the presentation. Now, today's topic is already told repeatedly, sex and sexuality in Indian adolescents. Particularly, I have taken this picture of Kolkata icon, the Victoria Memorial Hall, where many adolescents come for loitering and exploring the relationship, friendship to develop and to retain. So through that process, they have come across different type of issues, I should say health issues, for which they are taken to healthcare providers. I'll just cite few case examples in my presentation, how the adolescents are facing in relation to sex and sexuality. And this is my CV that's already read out. I am not going to that. I must thank the entire team once again for inviting me here. Now, the first slide, I'll show a few of the words related to sex and sexuality, what they exactly mean. Now, sex is the biological identity that's given at birth. So it's a boy or a girl. That depends on the sexual organs that is exhibited or anatomical organ that is exhibited. So accordingly, the baby is said male or female by the obstetrician. Then what is gender? That is actually socially constructed role and responsibilities that is assigned to women or men in given culture and location. So when we say culture, that means from culture to culture, the gender means the role of a girl, I mean boy or a girl, varies. Similarly, role responsibility of a woman or a man also varies. Similarly, say for example, say a man of say Nagaland, the role and social responsibility, and a man of Punjab will have different role and responsibility due to the local cultures. Similarly, the locations also, a city, in a city, say a boy or a girl might have different type of dress and other say behaviors, but in the village, it might be different. So the way the social structure supports them, that's also important. The parents and other supports. In the metro cities, there are pubs, the society supports it, so adolescents go there and enjoy it. So these are again part of the gender. That means it's totally socially constructed role and
three parts of
responsibility.
iceberg. आप सबने ये समझा होगा, सुना होगा, movies में.
Then the sexuality, it's a sum total of person's say personality, what he is thinking, how he is feeling, what he is rather desiring or planning regarding the behavior related to sex and sexuality. It might be there's fantasies related to sex. It might be related to different say imaginations, or it might lead to some different behaviors, or it might lead to different actions, and also relations with the peers and others. So sexuality is really the way the individual considers his sex feelings and desire. It may not be always sexual act. That is what we mean. It may be fantasies and imaginations also. Now, the gender and the sexuality is a spectrum. As I have already mentioned, the gender is socially constructed, say, roles and responsibilities, but the sexuality is the individual's perspective. Therefore, it may not match always. That's why there might be a change from this to that I'll be coming later. Gender identity is the way an individual wants to identify himself, that I am a boy or a girl, man or a woman. That usually corresponds with the biological sex, but it may not. And that's why the question of transgender and other gender neutral, non-binary and other gender identities are coming. Now, another term is important to understand is sexual orientation. That really refers to an individual's interest to other person in relation to sex and romantic love and romantic relations. So this is how I like to my partner, sexual partners. As a boy, if I want a girl, then we call it heterosexual. As a boy, I want a boy, then it's gay, then girl to girl, lesbian, like that. So these are sexual orientation means an individual's attraction to others. That is sexual orientation of the individual. Sexual health is, of course, it's a big term that will be coming in detail. It's not simply absence of illness or injuries. Reproductive health is a state of complete physical, mental, and social well-being, and not merely absence of disease, as we always define for any health, in all matters related to reproductive system and its functions and process. So that is reproductive health. It's not always the sexual health. Sexual health is more broad. I'll be defining it subsequently. Now, sexuality refers to your total self, your physical self, the way you look as a man or woman, mental self, you want to think as a man or woman, social self, you want to interact with others, emotional self, you feel about yourself and others, and ethical self, the way you value relations with your partners and the families and in-laws and others. So sexuality is a amalgamation of, say, biological sex, sexual attraction, sexual orientation, and then the gender identity, and all together ultimately forms the sexuality. So this is the sexual health. It's a state of physical, emotional, mental, and social well-being in relation to sexuality. It's not merely the absence of disease, dysfunction, or infirmity. All three words are important. Sexual health requires a positive and respectful approach to sexuality and sexual relationship, as well as possibility of having pleasure and safe sexual experience, free of coercion and discrimination, that it's a man predominating or a woman predominating. It should be free of, say, violence in relation to the sex. So sexual health to be attained and maintained, the sexual rights of a person must be respected and protected and fulfilled. That means my sexual health does not depend on me alone. It depends on my partner and the related members of the extended families and the society. So it is therefore important to develop a respectful relations and protect the opinion and consent and others of the partner and the related members. That only brings in sexual health. Sexuality, I have already explained in detail. There are references given. Now, the children are sexual being from birth. That is another very important concept that all of us must understand, that from 0 to 3 years, they really try to discover the different body parts and explore the different parts of the body, the hand, the face, then tongue, and then finally the penis and the external genitalia. So all these things, they try to explore the different body parts. 4 to 6 years, they learn rules. Rules means that the rules of, say, covering the private parts, then playing the different toys. It's boys' toys, these are girls' toys. Then initiating friendship with boys and girls both, and then gradually referring to one particular group or one particular individual. Then 7 to 9 years, the shame comes first. Then the child will resist when we are trying to take off the pant to which is covering the private part. So the shame comes, but before that, 5 years, it may not happen. Then the first love or the romantic relation might come a little early, even particularly for the early maturers, and that might also rather put them in a different situation than the parents. And then coming subsequent years, it's all puberty and puberty changes that we all know, and that ultimately takes them to adulthood, and that's very much related to sex and sexual health. Now, this is another important slide I want to mention, that mental health is very much related to sexual health and development of an adolescent. Because the sex is the center desire of an adolescent, and it is related to maximum emotion. Therefore, anything that is obstructing the desire is affecting the mind seriously, and that is affecting the mental health. Therefore, the sexual development and its progress, sexual health and progress, if it is affected, then the adolescent might be depressed. On the other hand, if the adolescent is depressed or otherwise for other reasons, then also that might affect sexual health and sexual development, because a depressed person cannot develop good relationship in, say, romantic relations and others, good manners. They cannot understand, they cannot learn it. And therefore, the third point is the stigma and discrimination. The stigma is, of course, when there is anything related to sex and sexuality, it is shame and secrecy that comes in, and that puts the adolescent in isolation and in distress and avoids going to healthcare facilities. So that is a delay in seeking advice leads to compounding of the problem. And similarly, we, the healthcare providers, are not always very comfortable to deal with these problems. That also compounds the problem and leads to, say, sexual health development problem or mental health development. Now let's come to a case study. Now, a school teacher came to your clinic with a child of, say, 4 years, and you have identified it's a respiratory infection, and then you have given treatment. Then the teacher is sitting and then trying to say something. Then you ask, what is your worries? Then the lady said that she has overheard amongst the students of around 6 years of age, the class, that they are discussing about masturbation leads to madness. 1 drop of semen is equal to 100 drops of blood. That girls do not masturbate. Now, I'll take a reaction from audience. So, have you had inquiries regarding masturbation or other sensitive matters from your patients or from the parents of your patients in your clinic? You can definitely give your response in the chat box. And if there is any response, I will request someone to tell me what is the response that is coming from the audience. Now, the next question related to that is.
Yes, sir.
Yes, if there is any responses, Chitra madam, you please tell me.
Yes, sir. Yes, sir.
So now the next question will be, how have you responded to them? Means the question of masturbation or others. Then why are such myths and misconceptions so prevalent? Of course, it is the misconception or myths comes from ignorance. If we do not know a particular reason for an event, then we always propose some hypothesis. But if we know the reason, then we say this is the cause. So why are such myths and misconceptions are so prevalent that I have already told? Why, in your opinion, does the teacher appears to so concerned? Why she is so concerned? Because first of all, it might be her ignorance. Secondly, it might be that she is having her own values, that what these boys are discussing at this age of 6 and 7, they're talking of masturbations and all that. How would you respond to the teacher? So these are issues that you have to address and think of, and then answer to the parents. Now, I'll just give the answers in just do's and don'ts in the next slide. So don't judge or disapprove her on asking such your guidance on this sort of topics. Avoid using or stating any cliches or any sort of unacceptable language regarding masturbation. Don't prevent further questions from being asked, and avoid stating facts that I do not know or I'm not sure. Rather, it's better to say that, well, I'll find it out and get back to you. But we must listen actively, and we'll request open-ended questions to answer, and we'll probe further why the teacher is so worried, whether boys and girls masturbate or not, whether there's any negative health effects. What is the concept of the teacher herself? Share with her wide spectrum of the expression of sexual health and the masturbation and the spectrum, both boys and girls, all these. Share with her all the documents that is available, written, audio or video materials, and encourage her to request her school to conduct sexuality education sessions. That will create opportunity for the students and also for the teachers, who can help the students to understand it. Now there is a quiz I am taking. Now both boys and girls masturbate. So the reaction is expected. Do you agree or not? So that is from the audience. So I'll give the answers subsequently. Second is, if an adolescent boy masturbates too much, his adult sex life will be affected. Most people stop masturbating after they get married. Do you agree or not? Masturbation is considered more acceptable today when it is used to be than it is used to be earlier. Still, it is common for people who masturbate to feel guilty about it. Is it true or false? Masturbation can cause pimples, acne, and other skin problems in adolescents. True or false? Homosexuals masturbate more than heterosexuals. This is another statement, true or false? People always masturbate alone. True or false? When they are masturbating, some people imagine that they are participating in sexual act. And this is a natural way of, say, self-gratification that is told in physiology. So do you agree or not? If the penis is touched too much, it will bend. Masturbation is a safe way in which adolescent boys and girls can deal with their sexual urges. So these are the 10 quizzes, that is common myths that's coming. I'm coming to the answers that already most of you know, that both boys and girls masturbate. Yes, we agree. The second question is, if you masturbate too much, adult life will be affected. Disagree. Third is also disagreed. Then masturbation is considered more acceptable, but still people feel guilty. Yes, agree. Masturbation causes pimples. No, it's not due to masturbation. It is due to some hormonal changes, we all know. So again, homosexuals and masturbate more? No. You don't agree? Please, people always masturbate alone? No, they might masturbate in groups. And when they are masturbating, some people imagine themselves participating in a sexual act. Yes. If the penis is touched, it really becomes hard. And masturbation is a safe way to decide. That is also, we agree. So now, few empowering statements that we must always speak to the boys and girls regarding sex and sexuality. Regarding the onset of menstruation, it's a sign of biological development. And therefore, we should tell them that you are now capable to become mother, but not yet mature enough to bear it from physiological and social grounds, because unless you are married, socially, it's not approved. So physiological also, infant mortality and maternal mortality will be higher, even if you are married. So these things we must tell them that you are now capable to become mother, but not mature enough. Then the second statement is also very important. Behave responsibly in your romantic relations, not to hurt yourself and neither the partner. Neither come in conflict with law. And there, when you say conflict with law, the question of consent comes that before 18, your consent for mutual relationship, sexual relationship is not valid. It's punishable by law. And you can also discuss about POXO Act and others. So this is how we can empower them that you are now capable to become mother, but not mature enough, and behave responsibly in romantic relations. So many things are coming. Similarly, for nocturnal emission, same statement for the boys. You are now capable to become father, and then all these series of statements. Now, if an adolescent comes to you and puts a direct question, is masturbation normal? What will be your answer? Now, we have now understood that yes, it is a developmental process. So if we say it's normal, then they might say how many times, and they might be obsessed doing it because they are more impulsive at this age. They might not be able to control. So that's why the best way we can answer is it's not abnormal so long it hurts your health and performance. And health means it is both physical, mental and social health. Similarly, performance means your academics and physical activities and social activities. So if it's not harming your health and activities, then it's normal. So you make your time management and all this, then it's fine. Nothing to say. So next, these are the references you can all go through from which we have collected these informations. Now, the second case, I'll say that an adolescent girl of 15 years who came to your clinic brought by the mother, and you find nothing is there, no physical illness. You ask the mother to wait outside to talk separately with the girl because you felt that the girl is a little worried. Special expression says that. And we find that the adolescent is really depressed and has suicidal ideation since the mother has forbidden any contact with the boy whom he really likes. So again, the issue, have you ever come across similar cases in your clinic of say likes, loves, or infatuations or this type of behavior in your clinic? How have you dealt with them personally and professionally? These two are important because you are a person there. Your behavior might be not professional always. What would you discuss with the girl and with her mother? Because here the discussions will be different. Would you consider involving someone else or refer elsewhere? If so, to whom? Now, this is one important signal that the suicidal ideation is there. Depression we can manage to some extent in our clinic with your experience, but when there is suicidal ideation, then that is called a red flag sign, and we must take help of say psychiatrist, and we must record it in our record sheet, and we must tell the parents to offer a support from the family. So these are again do's and don'ts. So don't prevent further questions from being asked by either parties, by the girl and the mother. And we should rather encourage the girl that you have expressed it, that this is the reason. Then we can discuss with the girl that why the mother is not allowing it. What is your idea? What is the reason you think of? And we can discuss the managements of that situation, coping the emotions and all that. We can discuss with that. And whether the girl knows about the boy whom she likes. So these are important informations that we want to know from the girl. And we should also talk to mother separately to tell that this is a situation that your daughter is very much depressed. And at this age, they are very emotional and she's thinking of doing some suicide or something. So this is very serious, and we should tell you to become more tactful and be supportive at this moment. It will a temporary phase and it will pass up. We will discuss it with the girl and we will also support you through the process. So this is how we face it. These are the references. So again, another study, a young man came to the clinic and then said that, doctor, I have no health issue at present, but myself and my girlfriend had decided to have sex with condom. So I am worried that it might rupture her hymen. So for that, I came to you to seek advice. So this is a boy of, say, whom you have seen for 10 years or more, maybe from the early childhood. But then again, this type of issues will come. How many of you have faced these questions in your clinic? How have you dealt with them? Would you have comfortable engaging with the young man? What would you tell him? Would you ask him about his girlfriend's opinion and readiness to have sex with him? So these are issues that we can discuss and then we can take it forward. And again, the same don'ts and do's we have discussed. We should encourage the young man to discuss this sort of personal issues, and we should not be judgmental and disapprove the topic. And we should also probe further, and then we should try to bring in issues of consent and the consent of the girl also, and the legal issues of the age of the girl and the age of the adolescents and related things that we should all discuss it. Now, I'll request Chitra Madam to remind me time, because otherwise I can skip two cases, because then go to the final few concluding slides.
Sir, this is interesting. You continue.
Well, these are references. The fourth case is a set of hurried parents approach to the pediatricians whom you have consulted in the past and say that they are embarrassed and concerned about to deal with a 15-year-old adolescent who is intellectually having intellectual disability. The child was found to be touching in public through their clothes the private parts of the parents and groping the physiotherapist also in that way. So is such behavior a result of sexual curiosity of this intellectual disability adolescent, or is a sensory need? Or is the child a victim of sexual violence? Is it lack of understanding of social norms from the adolescent? What are some of the things that can be said and or could be discussed outside the parents and at the outset to the parents and adolescents? So this is a situation where a adolescent with special needs or disability has come to you. And I must say that the sexual curiosity is always there in all who has got normal developments or who are having intellectual disability. They have sensory needs also. And this type of behavior could be definitely a sign of a victim of sexual violence, but it does not mean always it should be. So, and this could be a lack of understanding of social norms from an intellectual disability person, because that the social norms does not permit to touch publicly the private parts. That is not understood by the intellectually disabled individual. So we must tell the parents that this is a different situation and difficult situation to handle, but definitely will help you. And again, the do's and don'ts we have gathered, but don't leave the parents without a concrete step or with only one-time engagement. So you suggest something which is doable, and again you establish a relation. They should come back and try to support the parents so that they can, rather I should say, take this problem, lifelong problem with their daughter, to continue and to manage it. These are the references. You can go through it if it's necessary. Now, this is the last case. A girl of 12 is brought to pediatrician clinic for abdominal pain. And on gentle and persistent probing, the girl has said that her uncle has been playing with her through last weeks and threatened to kill her and her mother if she told anything. When this is a case of, say, sexual exploitation from their relatives and the family, that is the incidentally the commonest cause of sexual, I should say, exploitation of children and adolescents. The close relatives and friends easily are doing it. Whose consent is needed for medical examination? You can see the girl is 12 years old. Definitely, it's not, girl is not competent. The mother's consent is essential as per POXO Act. Should the parents be present when the medical and incidental history taking is being sought? It all depends upon the wish of the girl. If the girl doesn't want, then we should take one female attendant. What are legal obligations of the examining doctor? Definitely to treat the adolescent, and then also to communicate to the parents, and then to communicate to the, say, legal authorities or child welfare committee of the local child welfare committee or the police at least. So all adolescent healthcare providers should have contact of local child welfare committee's number and also local police stations number. So that is very important, and they should also make a note of what they have found in this case, because when we discuss with the mother or the parents, they may not like to continue this treatment and proceedings further. So in that case, we make a note that this has happened, and they have just left the chamber without giving follow-up and consent. So this we can tell them with the name of the patient and on the identity, but no home address or other things are available as the parents didn't take this. So this could be the situation. Again, the issues of don'ts and do's have come, and then here the POXO Act and our own responsibility comes. And the conflict is that the moment we try to explore or rather tell it to the parents, many of them do not want it to be reported to the police or the legal authorities, because the near and dear person is involved. It will lead to family scandal. So this is something very sensitive. We have to deal with experience and with this situation. Every case should be customized, but our main responsibility is to save ourselves and to serve. That is very important. These are useful resources. So finally, I must say that pediatricians are a change agent, and now more than ever, we need to support adolescents across the world to be informed and take control of their sexual health and well-being. Comprehensive sexual education is vital for healthy development, and schools are the right place to deliver this, along with the efforts of families at home. There are plenty of evidences that use of screening and intervention with young people for mental health disorders and health compromising behaviors in clinical settings improves the health outcomes. Therefore, all of us should be vigilant to all adolescent patients whenever they come to our clinic for any issue, be it acute illness or any other health issues not related to sexual health. We should explore it. And pediatricians are trained to view the child as a whole, not a particular disease. They are not a system disease or a disease specialist. Along with the parents and caregivers, they have got long relations. The parents also trust them. So they are the person who could ultimately mediate to make a great life for the adolescents. So there are evidences that there is 30% reduction in delay in sexual initiation who has got comprehensive sexual education, 20% increase in condom use, 20% increase in gender equity and awareness, and there is also reduction of, say, I can see the slide here, so let me just take it on that side. 25% reduction of risk-taking behavior. That's also very important. We should remember that risk-taking behavior is also reduced when we give them the sexuality education. So comprehensive sexual education empowers the young people. It does not make them more promiscuous or enter into the sex at early age. That is what we must say. And this is the final slide, that 2 to 7 years, naming body parts and personal boundaries, basic hygiene practice, appropriate and inappropriate touch should be told them, private and personal space should be told. And from 8 to 12, the puberty changes comes, and then menstruation, voice change, and these nocturnal emissions we have all discussed in detail. Emphasis about consent and boundaries. Then healthy body image and self-esteem should be considered. And from 13 to 18, the comprehensive sexuality and reproductive health education is very important. We should all promote it to society and the school and to authorities wherever we have access. Emotions, healthy relationship, and communication skills is very important. First of all, we should learn it and we should tell the parents. Media literacy and critical thinking about sexual content is also very important. They should not get attracted to the sexual content in the media, but they should also try to learn how. That is what is called media literacy, and they are not using them as customers. They are using the media as knowledge and to empower them. So thank you very much for the patient hearing. And I once again thank all of you for this opportunity. I stop sharing.
Yeah. Yes, sir. And forum is open for question answers. Sir, I have few questions. We can
Yes, please
go through one or two questions. So how the emotional quotient is important in dealing with this growing up period of sex and sexuality, especially the gender identity?
Well, emotional quotient is something different than intelligent quotients. All of us know all these things, but the point I want to make that emotion is very much heightened at this age, and therefore what the way we respond, say at this age of mine, or say a young boy or a young man or woman responds at the age of 35 or 40, is not expected from a boy up, say, 12 or 13 or 14, because they have emotional urge and sexual urge maximum. But at the same time, what is good for them and what is socially accepted, this type of monitoring from the prefrontal cortex is not yet developed. So what they do, they behave impulsively. So they might do something which is harming them, which is harming the society. So this should not be dealt with very lightly. Rather, it should be dealt seriously and compassionately, that it's a temporary event. The adolescent needs support, and what is good and what is bad should be discussed with them till he or she is convinced.
Chitra?
Yeah. Yes, sir.
Sir.
Patil, sir? Yes.
Yeah. Thank you. Sir, I should congratulate for an excellent case-based discussion. My question is that most of the adolescents know, like...
A little louder, please, Arjit, sir.
Yeah. Am I audible, sir?
Yes, now better.
Okay. It has been seen that most of the challenged children, they express their sexual urge by handling or some groping, and these parents, they say it's or the caretaker, what they say, they suppress their sexual urge. Is this causes some problem in future in this adolescent challenged children? Are you getting, sir, my question?
You are saying that they are not able to disclose it.
Yeah, no. Actually, when they express their sexual urge, the caretaker, the parent, they say it's a bad. Don't touch it. Don't do this. Is this causes some problems in future?
Yes.
No. If the question is that if you do it, then this is bad. Then no, I should say opinion shared by the adolescent should be summarily disposed of. It should be first of all understood why he or she is telling this, why he or she is behaving like this. So the perspective, the situation where he or she is exposed to, all this should be taken into account. And then our primary aim as a service provider or as a parent also is to understand the situation and to support the adolescents or empower the adolescents how to win it over. We need the situation in his or her favor. That is our aim. But if it continues, then that might definitely affect the mental health and the sexual health of the individual.
I want to say whether they are suppressing the sexual urge of the child.
Well, they cannot, because this
That
is
is
a
also
biological
normal.
urge.
Yeah.
It's a biological urge. You cannot. If you suppress or put a carton here, then it will be expressed somewhere else. So better the parents and this service provider should be more open,
Yeah.
and they should be getting more information, and they should be more friendly with the adolescents so that they can express all situations they have faced outside and what they have done, how better they could have done it. So this sort of discussions, however, whatever embarrassing it is, should be always between the child and the service provider, and then child and the parent.
Thank you, sir.
Yeah, sir, there is a question in chat box from Dr. Shirley that a teenager girls come to a doctor. She is having sexually transmitted disease. She is having a partner, but she has not disclosed to parents. But how the doctor should go ahead?
Well, so here the doctor's responsibility is primarily to treat. Therefore, doctors, if he has identified the sexually transmitted disease, then he should treat it. And then he should also discuss with the adolescent that this is how it has happened and what it can lead to, the question of recurrence and subsequent issues of this relation. So the treatment of the girl is not enough. The treatment of the partner is also essential. So these things should be discussed with her. And if the she is not able to, I mean, we are not able to convince her that the partner needs to be treated, otherwise you will get recurrence and all that. So then it's our failure. We should continue our relations and try to convince her to bring the partner and at least to get the treatment for the partner. So this is how we can address this issue. But we are not going to give any judgment that this is you should not do at this age. This is not befitting with your age. This sort of judgmental statements will discourage or rather will break our relation with the our client, the adolescent, and she will not submit total information subsequently. So that will rather come on the way of management in future.
Sir, our extended question is, shall we share about the sexually transmitted disease with the parents? And the counseling, it should be separate with mother and separate with the girl, no?
Yes, definitely, because the parents should be informed, but the information must be with the consent of the adolescent. With the consent of the adolescent, because here the adolescent's treatment is given, and if it is curable, that's fine. But the question of recurrence is there, that we'll get time. It's not a life-threatening situation, and it's not like a pregnancy where it will grow and ultimately it will be socially revealed. So here we should definitely try to get consent from the adolescents to talk to the parents, or rather disclose this to the parents. But unless we get it, it's not an emergency. We'll not tell it to the parents, but we'll say that there is some infection in your daughter and we are treating it, and we have to continue this management. Subsequently also, we will be working on it.
Yes, thank you, sir. And now I invite Dr. Shailaja Mane, our
But
chair.
there is another, this is not under POXO Act since it's minor.
This
So,
is not under POSCO. Sir, there is a controversial thing. POSCO.
No. The issue is that if the girl is less than 18, definitely this is under POXO Act, and then the duty of the doctor is not only to treat but also to report to the authority. So there, the breach of confidentiality is a must. So when we talk about start talking to that adolescent, at the beginning we tell that you can speak freely with me. Whatever you submit, we'll keep it confidential, except in very few situations. So if the adolescent asks at the onset, what are those exceptions? Then you might say, well, we'll explore it and tell you once you start discussing. It may not be necessary for you also. So it's so that we are not threatening it from the beginning that in this case we will report to the police. So let the adolescent tell this story completely, and then gradually we will explore that this is the treatment you require, this is the care you require, this is here you need the involvement of your parents for the total care and for the total well-being also. And I have got some responsibility also to report it to the authority so that this sort of things doesn't recur. The partner might also infect other girls also. Therefore, this is a state regulatory that we also should report. Here I cannot retain the or maintain the confidentiality agreement that I have came to you or have done with you at the beginning. So this is a point that you are referring at the beginning. So here we have to break it. So this is how we can go.
Yes, sir. When POSCO comes, there are a lot of controversies and the discussion may go on. Now, may I invite Chairperson of Maharashtra AHA, Dr. Shailaja Mane, ma'am. I could see her. Ma'am, please give your inputs. Is she there? Dr. Sunita?
I can't see her, Chitra.
Okay, not yet joined. Okay, may I request Rotary Club Kharghar Midtown President Dr. Ravi Kiran to give his comments about this session.
Good evening, ma'am. Sorry, I'm traveling. That's why my camera was off.
It's
Ma'am,
okay.
let me be very candidly, I'm telling you, representing Rotary Club, ये सवाल है कि ये topics and resource persons कहाँ से लाते हो यार? Seriously, too good. I mean, trust me, I just came out of one college activity and I'm going to one RCC meeting with Dr. Komal. I'm in front of her house. I stopped and I'm listening so that, I would like to give this feedback. We do conduct meetings, we do get the resource persons, but those are on the other level. And you people, thank you so much. And I would request, let's try to come up with something where we can have these physical meetings, which will be beneficial to all other people who are missing it. Thank you so much. You being a very great resource person, getting the stars like Sukantaji and all. I mean, appreciate nothing. I mean, I'm not at all a qualified person to comment something, but itna feedback to zarur de sakta hu ki absolutely awesome. Thank you. Because, these are all the very niche subjects where people do speak very less, honestly, I'm telling you. But despite of knowing the problems, they don't come up. But we as a change makers, we should process and then, let the people know and speak openly about these things. Thank you so much, sir.
Thank you. Thank you.
Thank you.
Yes.
That means the message has gone correctly. Thank you so much.
Oh, yeah, absolutely. Yeah.
Sir, it's adolescent health care is not a role of pediatrician only. It's for everyone. It's not only for
Exactly.
doctors, it's all healthcare providers, all social activists and parents and everyone, because adolescent has got so many issues that are mostly coming from society and family. Therefore, we should be supportive.
They are getting easily influenced. That is another problem, unfortunately.
Yes. Because they are attracted by the so-called distractors of the society.
Yeah, which are freely available.
Yes, but all attractions are associated with risk in the society.
Agree.
Thank you. And over to our Innerville Club Khopoli President, Mrs. Deena Shah. Please unmute. Deena, please unmute.
Okay. Thank you, ma'am. थैंक यू डॉक्टर सुकांता चैटर्जी सर, बहुत ही अच्छे से आपने बताया है कि आज की जनरेशन की जो प्रॉब्लम है तो उनको सॉल्व भी कैसे किया जाए। और डॉक्टर रवि किरण ने भी बहुत ही अच्छे से बताया कि आपने जो ये टॉपिक जो लिया है जो आज के रिसेंट में बहुत जरूरी है। और मैं इसके साथ आपने जो बोला उसमें ये भी कहना चाहूंगी कि माँ बाप को अपने बच्चों के साथ इस बारे में बात करनी चाहिए खुले मन से, ताकि दोनों में अगर बच्चे के मन में भी कोई प्रॉब्लम होता है, कई बातें उनको समझ में नहीं आती, ये जो उम्र उनकी रहती है उस टाइम पे, तो माँ बेटी के साथ अच्छे से बात कर सके, पापा बेटे के साथ अच्छे से इसके बारे में अगर बात करे तो बहुत ही उनके मन की जो कुछ बातें रहती है वो बहुत क्लियर होती है। और उनको ये भी हमें समझाना चाहिए कि उनकी उम्र में ये सब होना पॉसिबल है, लेकिन उसको आप कैसे उसको कवर कर सकते हो और आपको कैसे रहना चाहिए सोसाइटी में, वो उनको बताना जरूरी रहता है। थैंक यू वेरी मच सर, आपने बहुत ही अच्छे से बताया। उसका कुछ परिणाम होता है तो उसके लिए भी माँ बाप की तरफ से भी क्या एक्शन होनी चाहिए और एज अ पेडियाट्रिशियन डॉक्टर भी क्या साथ देते हैं।
हाँ, वो खोला मुंह से बात होना चाहिए
हाँ
बच्चा के साथ मदर को।
हाँ
और ये भी होना चाहिए कि मदर को ऐसे बोलना है कि जो भी कुछ आपको मन में है तुम बता सकते हो,
बता सकते हो,
मैं बुरा नहीं मानूंगा।
नहीं मारूंगी, और उसको बोलना कि हम हमेशा तुम्हारे साथ है, अगर तुम्हारा कुछ गलत
हाँ,
होता है तो भी
राइट
हम
राइट,
तुम्हारे साथ है। तो कभी बच्चे का कोई हो तो वो माँ बाप से घबरा ना जाए, वो उनको ही
यस,
बताए।
हाँ वही है, वही पहले ही बताना कि हम बुरा नहीं मानूंगी।
नहीं मानेंगे।
Very important point. Thank you, Mrs. Deena. And this is the requirement of this generation.
या
पहले हम लोग जो छोटे थे तो बहुत सारे लोग आजू बाजू में रहते थे जिनसे हम शेयर कर सकते थे, और सिर्फ माँ बाप के ऊपर उसका बोझा नहीं था। लेकिन अभी विथ न्यूक्लियर फैमिलीज, ओनली वन चाइल्ड, वन मदर एंड वन फादर, so our responsibility has increased. Thank you very much. And I could see our sister organization, Palghar Academy of Pediatrics President, Dr. Jayashree Deshpande. May I invite her for vote of thanks?
Thank you so much, sir. Dr. Sukanta, sir, your insight on this topic, which has
Namaste,
a
madam.
stigma. Namaskar, sir. Which has a
Before
stigma in our
vote
society.
of thanks of
Yes.
Jayashree,
Yeah, Dr. Shailaja, madam,
I would like
want
to
have
apologize that
your
I could
words
not.
of wisdom.
Good afternoon, Shailaja.
Good
Mane
afternoon, sir. I
madam.
missed, but I will definitely see the record, and I have shared it in many groups.
Shailaja Mane,
From mobile,
respond.
I was trying to join, but because I was in a hospital building, and ultimately I came here, and in the PC I could join.
That
From
is so
mobile, I
nice.
was not
Thank
able
you,
to.
thank you
nice.
very
Sorry.
much.
Yeah.
Thank you.
Sorry.
Yes, ma'am. Go ahead.
Please,
We
Shailaja,
Shailaja
want
please
madam.
your
give
words
your
of
inputs.
wisdom, madam. We want to hear from you.
Oh, is it? मला वाटलं तुम्ही vote of thanks देताय.
नाही, नाही.
No. Already stalwarts had addressed this address, but I was also very much interested that how sir is addressing. I wanted to learn, but I will definitely go through the link. And I'm very much thankful that AHA Raigad had taken this initiative. Raigad AHA and Palghar Academy of Pediatrics, along with Rotary Club Kharghar Midtown and Innerville Club Khopoli, which is very understanding the sex and sexuality in adolescent is very, very, very sensitive topic actually. For adults also, it is very sensitive. And this topic related to adolescents is again very, very much sensitive. And particularly even I have seen doctors and many people are not comfortable to speak about sexuality with their own boy or girl or adolescents in the family, friends, etc. So I think this is need of time, and we should address to the parents and doctors, healthcare workers, may it be general practitioner, may it be any physician, or maybe be any surgeon, because we have many opportunities in the life to interact with many adolescents. How to address this issue is very important, and I think we should give training and conduct the sessions for them as well, for parents, for teachers even, because this one is very culprit and it is giving misinformation, wrong
Yeah.
information. And it is our duty as responsible healthcare workers and adults of this country to give proper information, scientific information, which will be useful to the adolescents. So I again congratulate. I am sure that Sukanta sir had must given excellent information, which I have missed, and I want to gather that. And again, continue to address these such sensitive topics, AHA Raigad, and keep adding on to the benefits of society. Thank you, sir. Thank you all.
Thank you, Shailaja madam.
Congratulate Chitra and entire team. Thank you.
I have
you.
just informed with my case experiences that how the cases are coming to us. But
Okay.
what you said is most important. We
Yeah.
must train the parents, and also many of our healthcare providers are not comfortable to deal with this sort of issues that you
Yes.
have pointed out. So these
Because
things can.
nobody had told us, sir, ki how
Yes.
to address this issue. And
Right.
we have grown up in what we can say very close community and with many joint family. So and still in our community and our country also, that it is not such openness about this topic is not there still.
So more we discuss, more we'll become free and open. That is how we should do. We should
And
first
that
of all
is
talk with our
important.
own professional colleagues.
Correct.
Then
Correct.
we should talk to the parents, and then finally with the adolescents. And
Yes.
more you practice, more you talk, then you become free.
Correct, sir. Thank you, sir. Thanks a
Thank
lot
you.
for taking lead in this.
Thank you, Dr. Shailaja. And it was very important point that you told that more we discuss, sir also told that more we discuss, more we will be comfortable in dealing with such cases. Over to Jayashree.
Thank you so much for your insight on this topic, which has a stigma, sir. And this sex and sexuality is also related with the mental health of the adolescent and the future whole life ahead of them. And thank you, Maharashtra AHA President Dr. Chitra Kulkarni Madam, President Dr. Raigad AHA team, Dr. Sunita Inge Madam, Raigad President Dr. Vikas More sir. Thank you, Dr. R.J. Patil, sir, from Nagpur. And thank you, Dr. Shailaja Mane, madam, for your august presence and words of wisdom. Thank you, all the doctors who are present today. We will definitely spread this word. And thank you for the Inner Wheel Club, as well as the Rotary Club from Kharghar and Khopoli. Thank you so much, Dr. Sukanta, sir. We would like to invite you again, and we will like to spread this word more in the society. Thank you, sir.
Yeah,
Thank
and
you.
big thank you to Dr. Vishal Raut, who is always backbone of our webinar and helping us to conduct the webinar smoothly. Dr. Vishal Raut has managed the Zoom properly along with my co-moderator, Dr. Sunita Ingre, for conducting this session. Thank you so much.
Thank you.
Thank you.
Chitra.
Thank you. And
Thank you, Dr.
and once again, I thank all of you to invite me and give this opportunity to speak on a topic that comes from my heart.
Yes.
Thank you, sir. Very
Thank
well.
Thank you, sir.
Thank you.
बहुत अच्छे
Stop
से
the live
Thank
stream.
Bye.
Yeah. Can we stop the live streaming? Yeah. Thank you. Bye.
Bye.
Yeah. Shall we end the meeting now?
Yeah, yeah.
Yeah.
Yeah, bye.
Thank you,
Thank
Chitra.
you, Shailaja.
Bye-bye.
Thanks.
Shailaja madam,
Thanks at the
namaskar.
end. At least we could make it.
Thank you ला आले मी काय करणार
Yes,
सॉरी
thanks.
Thank
ऍक्च्युली
you.
आमची आज गुरुवारी ना हे असती कॉलेज काउन्सिल मीटिंग असते ती आज
Yes.
खूप एक्सटेंड झाली
Yes.
Mane madam, namaskar, Orange City.
नमस्कार
Thank you, Dr.
Chitra, the live has not ended.
Yeah. We have to stop. Yeah. Thank you. I'll stop.